One member of the audience references an article that was in the New York Times yesterday. I'm sure you saw it. I'm sure it was timed intentionally by the Times, criticizing the McCain plan on the day of the debate, in which they were able to get some quotes from some business people who said the McCain plan might be bad for business because it may, by putting this, by severing that relationship between healthcare and the employer, you will weaken that provision of healthcare services and maybe lead to more uninsured.
Yeah, well, I have some trouble understanding how this one works, and I've seen the logic behind this. Employers are not required to offer health insurance today, so therefore they could drop it tomorrow if they wanted to. The fact that they don't is because we have a more or less competitive labor market, and if your competition is offering health insurance, you feel like you have to offer it too, or offer higher wages to make up for the fact that you're not offering health insurance, but you have to compete with the guy across the street who's offering health insurance. Why this is going to suddenly change under the McCain plan, I don't know. The other fear is that companies with a lot of healthy people, their people will say, give me the money and let me go shopping for myself, leaving companies with a lot of old sick people who still have to pick up the insurance costs. There's some truth to that. But McCain has got some changes he wants to talk about. He's talked about risk rating, perhaps the tax credit. He's talked about doing some other things that might offset that. But that's not a big problem. It's being grossly exaggerated. But it's a real issue.
What percentage of unemployed are, it says unemployed, maybe it means uninsured, are so because of the employer-based portability problem? I think the question here is...
Yeah, it's the vast majority. The reason why people generally are uninsured, there's two reasons. One is you're young and healthy, and they are voluntarily uninsured, in fact. If you're in your 20s and you're in good health, you choose to go uninsured because you'd rather spend that money on booze and girls. I mean, that's, give me health insurance, fun time, so, I mean, they tend to make that decision, and by and large, it's a rational decision, particularly if we do things that drive up the cost of insurance. We don't let them buy cheap insurance. We tell them the only insurance policy you can buy is the Lexus of insurance policies, and they look at the price tag and they say, no way. And so you have that group. The second group is the people, as I say, who cycle in and out of the insurance market, and that's primarily loss of jobs.
Do you see any solution to the constant increase in cost of health care, now approaching 1/5 of gross national product? That says production, I think they mean profit.
Yeah.
Is that a problem? I mean, what percentage should it be?
That's a good question. I have no idea. I'm pretty sure we don't, pardon? Yeah, and is it too much? Probably, but I don't know. I mean, what is the right number? It's 15, it's a little over 15% right now. Should it be 14.2? 12.75, 18.7. I can't possibly tell you what the right number is
and if it's
for
health care.
If
it's supposed to be a smaller proportion
or anything else.
Then what thing is supposed to grow to spend more on? Right?
Well,
I mean, it has to add up to 100%.
Somewhere else,
right?
but that's fine.
Yeah.
But that's fine. I mean, I'm pretty sure we don't want the Bangladeshi healthcare system. They spend 1% of their GDP on healthcare. Nobody's been advocating that. But beyond that, that's what markets decide. How much we want to spend on healthcare versus how much we want to spend on tennis shoes versus how much we want to spend on new cars, and eventually it adds up to 100%. The problem is, in healthcare, we don't have a market because as I went back and said, you're not determining how much you're going to spend. You're not making choices of price and quality. You're not going in and saying, do I really want to spend the money on this? Is it worth what I'm spending on? What's the value I'm getting for my money? Someone else is paying for it, so you have this tendency to overconsume, and that drives up healthcare costs. In a real market, whatever we came to as a percentage of GDP would be because that's what people decided they want to do. They'd rather spend money on healthcare than cars. The problem today is spending money on healthcare, someone else buys it. Spending money on cars, I buy it. I choose the healthcare over the car.
Final question from the cards. This member of the audience is in a philosophical mood. Government-run healthcare, or some kind of mandated healthcare system, is it a form of eminent domain over the body of the individual on whom it's mandated?
Very good question. I'm going to come back to that one in a second. I want to just finish answering. I'll go back. I just thought of something in terms of this cost thing before. Think of it. I want to give you a thought experiment on that first. Think about it this way. if every time you went to the grocery store to buy your groceries, 83% or 87% of your grocery bill was paid for by someone else, you only paid 13 cents on the dollar for your groceries. You'd eat a lot more steak and a lot less hamburger, and so would your dog. In the end, the cost of groceries would go up and up and up, and we'd be spending a huge amount of our GDP on groceries. And it's because that, versus what you have to pay for yourself. Now, in terms of the eminent domain question, yeah, I think it actually is. I mean, ultimately, it comes down to who, back to this who decides question. Who owns our bodies? If we own our bodies ourselves, then we get to determine what to do with them. And then we get to, then we therefore own our labor, because we choose to work and we make things out of with our bodies, so we get to own the fruits of our labor. We get to choose how to dispose of the fruits of our labor by who we give it to or who we sell it to, what we sell it for. All these other rights ultimately stem from this idea of self-autonomy and the fact that we own ourselves. And if we give people control over ourselves, if other people get to tell us what we're going to do, then we're a little less free, a little less autonomous. Someone else gets a little more ownership over us. So I think that's where, that's, in a philosophical note, I guess I can leave it at that.
Yes, I'm tempted to ask a theological question. What if God owns our bodies? But maybe that's for another time. I think it leads more towards the freedom answer. Thank you. Thank you, Michael Tanner. My mind is sort of still worrying on this question of parents being fined or punished in some way. And I'm just wondering, what are the social implications of that in an environment in which to have a child is to automatically bring a government mandate on yourself? And what are sort of the generational implications of that environment? And there's been a lot of sociological study about sort of the relationship between pension plans and, the severing relationships between generations and how is Social Security affected, or public pension plans or private pension plans. I'm really just, I'm really wondering how does the world change if when you have a child, you're not just deciding to have a child, but you're deciding to invite the government to fine you depending on the health care plan that you purchase for your child.